which is Timmy. I know we've got maybe thoughts in elsewhere, what's going to be announced, but we'll hear that after the meeting, which I'm quite sure you'll have taken time and went through. Before I ask for apologies, I think you would agree, having read the papers, the last cycle we had very interesting statistics from the department and how they address COVID. I think this time round, they put, maybe not a good analogy, but it's the most appropriate one, is they put meat in the bones of the statistics we got 3 months ago. And you see how they've managed to keep services functioning in conjunction with other departments, the voluntary sector and so on and so forth. So these reports really tell us where we are. They're not all COVID related, but are just COVID related, but they certainly obviously have got COVID content in them. So with that introduction to it, I think we'll start formally and ask for any apologies if you've had them all submitted, Andrew.
Yes,
Kevin Doherty.
Kevin?
Apologise, it's a hospital appointment.
I understand.
Other apologies I've received, convener, are from Councillors Cameron. Doherty has just indicated. Councillor O'Rourke is substituted today by Councillor Rorty, and apology for Councillor Weir.
Could I add an apology for Councillor Catherine Johnson, please, Andrew?
Yes, I've got that recorded, thank you.
Thank you.
Thanks, Claire. Am I right in saying that I heard that Tom's in hospital? Is that right? Tom Johnson, her husband?
Yeah, he's improving, Tommy. He had an infection, but thank God it wasn't COVID. But it's been a difficult few weeks for everybody. But he's doing fine. Thanks very much.
Thanks, Claire. Obviously, we'll pass on our regards.
Absolutely. Sorry, convener, can I maybe come in there? I didn't know anything about that. Could you please pass on my condolences?
Absolutely. I just heard about it and passing towards the end of last week.
Yeah, thanks.
I think we might, the business manager's substituting, maybe Louise, we could say, just in case there's other Labour members, we'll make sure that those best wishes are conveyed via the channels. So if that's the apologies,
thanks for that, Tommy. Appreciate it.
Great, Claire. And the substitutes, Louise, you're there. We'll then turn and ask this before we start item 2, if there's any declarations of interest in any of the items here. If there aren't, we can then go into, as it says here, the operational, how we managed to keep things, or how the departments and our department have managed to keep things functioning. And Ross, I know you've got, this is a lot of planning into this, and we've managed to look at prevention, early intervention and capacity building and well-being of the staff. That certainly when you were putting this together, we weren't aware of the challenges that we're going to be facing. If you'd like to take us through this as the first item on the agenda for presentation. Thank you.
Okay, thanks, convener. Yeah, I mean, I think as you say, the plans around this one have been, I suppose, been through committee a few times previously, and obviously this has been a bit of a challenging process as we've been developing through COVID, particularly because of the fact that a lot of our health improvement staff were deemed important to be elsewhere, so things like test and protect, etc., and also doing some of the work around shielding as well. Were ended up being the sort of priority areas for a number of our health improvement staff. So that did have a bit of an impact in terms of capacity to deliver some of the programmes throughout 2021 so far. And now really just doing the sort of recovery piece around a number of those service areas, trying to get them back up and running. But the report runs through a number of early intervention programmes, things like the Keep Well programme, where we provide really quite intensive inputs and supports around individuals, and particularly focused around things like justice, addictions, homelessness, Black and minority ethnic communities, etc. And 1920, we showed quite a significant improvement in terms of where the service had been previously, and developing that approach. And I think this is one that, as I suppose, a methodology, is actually something we've started to learn from. So we also had previously brought to you the updates around the intensive resource users as well, and again just try best to use the high resource user piece is about identifying those who use quite a significant proportion of emergency department time, etc., and try to use that sort of same methodology of actually getting some intensive input into those individuals to provide additional support. So that's been quite an important programme in terms of setting that going forward. We've got the work around the Green Health Partnership, which is looking at some of our social prescribing and providing green alternatives for individuals. And again, that's been a programme that has worked quite extensively across the whole of Lanarkshire. But we've covered over 300 health and social care professionals in terms of educating them in what's available in their local areas, so that we can increase the referrals out to that type of pathway. Similarly, with the weight management service, this has been heavily linked in with culture and leisure colleagues, and obviously a significant impact within the current year because of COVID in terms of how that's working. But we've also been rolling out the healthy schools approach, and over 80% of primary schools are now signed up to that across North Lanarkshire. So we're getting the weight management process in place from quite an early age. And then the tobacco control strategy, again, quite an extensive piece of work being done here in updating the overall strategy as well. And we're sort of doing a sort of mid-year or mid-term review of that whole approach, and tying it into the Scottish Government changes. So the Scottish Government changes have been much more focused on the Scottish Index multiple deprivation 1 and 2 around it. So we met the target in 1920 of over 900 quits at 12 weeks. I think it was, as in the report, 557 quits in North Lanarkshire as part of that process. So then jumping on then to the mental health and wellbeing strategy, again, we brought this through committee at the start of the year. And obviously a lot of work that's been put on hold off the back of COVID, but we've re-kick started, I suppose, this whole work stream now. We've got the sort of 4 main areas of work within this around good mental health for all, which is looking at the sort of general preventative type approaches, the improving access for young people, improving access overall for the entirety of mental health services, the children and young people's wellbeing as part of that as well, and then also onto some of the specialist services. We've got other national developments coming around things like eating disorders, etc., that will continue to develop in that area. So what we've had a couple of stakeholder engagement sessions now over the last couple of months around how we restart some of these. We've been reviewing where we are and the action plans against each of them, and then starting to reprofile those back out again. So we've obviously lost 6 or 9 months really out of the programme schedule, but we're now really just setting that back up again and starting to reprofile all of that, and also just done a bit of a recheck of the governance around it, and making sure we've got the right people on the work streams and the work plans as we've taken that forward. Community Solutions has been a piece of work that's been going on since the start of Reshaping Care for Older People, which was 10 years ago, or over 10 years ago now. And the COVID piece has really just brought this to the fore. And I think the impact that we've had has been really quite extensive through COVID. But the table in 2.4.2 of the report on page 8 is really given the entirety of the 1920 report. You can see in terms of the type of figures we're looking at, that's made such an impact in terms of over 10,000 people supported around isolation and loneliness, over 12,500 in terms of signposting to for self-help and that sort of thing. And the whole outcome approach of this programme has been long developed, but I think it really helps us to evidence the sort of impact it can have on people's lives across North Lanarkshire. And that's an area that we're just continuing to develop, particularly off the back of some of the wider learning across all council services. And myself and Alison and Lizanne McMurrick and a few others have been sitting on a wider group as well, just reviewing the voluntary sector input across the whole of council services, so we can try our best to get that as aligned as we possibly can. And particularly about there as well, about really focusing in on what are the absolute deliverables that we really need to see as a priority for that area of work. For staff health and wellbeing, we took a paper through the NHS board at the end of October, and then through the IGB subcommittee at the start of November. for sign-off around staff health and wellbeing. And I suppose one of the sort of nuances of the COVID response has been that the social care element sits within the NHS mobilisation plan. So through the NHS mobilisation plan, we've developed a staff support piece around health and wellbeing that covers the entirety of health and social care, including independent providers, care homes, etc. And we approved that in October through the NHS board and also through the IGB in November to run on for the next 18 months. And we felt it was really important to get that sort of time frame on it because of the impact of COVID has obviously still got some way to run. But we also, the research shows that the potential impact shown through on staff may come at a time after the end of the pandemic response. So we felt it was really important to get that piece delivered on a sort of extended time period. So that's now fully funded for the next 18 months, and as part of that approach, we'll be developing a new strategy around health and wellbeing that will come through all partners before the end of that 18-month period, so that we end up with something that's sustainable in the longer term. So a whistle-stop tour of a really quite extensive area of work for us, but happy to take any questions that members have.
Yeah, thanks, Ross. Good tour around the various avenues of the various funnels there of prevention, community solutions and staff wellbeing. I noticed that I've got Bob Burgess up here. Bob, I'll bring you in.
Thanks, Tommy.
Yes.
Ross, a really good report. I'm quite interested in this booklet that you're putting out to the people in their own homes for exercise and posture. I did a few years at Carluke Community Centre in conjunction with my judo club on the self-same thing. Is there any chance of getting one of these booklets myself?
Yeah, very happy to. I'll take a note and we'll get some information across to you, no problem at all. And if it'd be useful for other members of the committee, I'm happy to get that just shared more widely.
Lovely, thanks.
I noticed next I've got Michael McPate.
Thanks, Convener. Very good report, Ross. The national news today has been painting a very, very negative picture, a pessimistic view on adult mental health.
Mental health.
I'm just wondering where we are. Are we up to speed? Have we got as much resource in there as possible? And are we back to meeting the public? Obviously, it looks like we're going back into some sort of lockdown again. Are we ensuring that these services are there when people need them? Thanks.
Yeah.
An excellent question.
Yeah, I mean, it's a really pertinent point, Councillor. I think we've got quite a lot. It's one of the areas we've probably got more evidence base behind in terms of some of the international evidence base. So it was projecting at the outset of this that we'd see an 8% increase in demand across pretty much every sphere of mental health services. And I think the feeling in Scotland's that's probably an underestimate in terms of what we can probably expect to see through. So we've got a plan. We've been having weekly meetings with Scottish Government from the outset of the pandemic around mental health. So the Mental Health Director will be meeting with us on a weekly basis, and that's really been focused on the fact that we do feel that this is going to be one of the biggest areas of increased demand that we'll need to try best to meet off the back of obviously the challenges of waiting times and all the rest of it from the initial impact of the first lockdown. So what we've got now is really a mixed economy in mental health services, where we've got some degree of phone contact, of near-me contact for video consultation, and then face-to-face where it's required as well. And every service has had to work up. So for all the community mental health teams, through all the specialist services, and then CAMS, etc., and children's as well, have all had to work up their own recovery plan in that light. So setting out exactly what triage and what initial contact and support can be done electronically, what needs to be done face-to-face, and how we can meet that locally within the health centres, and I suppose the flow of demand. Probably an increase of home visiting, rather to try our best to reduce the footfall in some of our sites, etc. So quite a different model of care. But one that probably the area of all the services that we probably had the greatest scrutiny over from national colleagues. So I think, yeah, we're largely where we can be just now. There's no doubt about it. It's there have been impacts, and some of the waiting times have been extended because of it. But what we have seen is the opportunity to introduce some of, I suppose, some of the overarching direction of travel anyway. So I'll give you an example of CAMS, where the national review around CAMS was asking for a senior triage of all referrals as they came in. And that was at the time felt within our business model quite challenging to put in place. But what we've done is we've been able to do that via Near Me, so that any new referrals coming in will have a Near Me assessment with a consultant. And what the output of that has been is we've actually picked up a whole range of cases that probably didn't need CAMS, but we've been able to signpost to a more appropriate service right at the outset, so they're not waiting 18 weeks to be seen and then having that done. And I think the feeling from the services is that type of approach is actually reducing the overall demands on the service, because we're actually picking up folk more appropriately earlier on before they deteriorate. So there's been a range of learning that's come out of COVID that's actually been quite positive, as well as the challenges. So I suppose in short, yeah, I think we're just about there. The mental health plan is on the NHS Lanarkshire website, the whole 70 pages of it. So if there's any elements on, you can go into service by service to see the type of approach that's been taken. So it's in the public domain alongside the NHS mobilisation plan.
Thanks for that comprehensive response, Ross. I'll just run through the list. I see the next one is Angela, Councillor Feeney. Angela.
Thanks, Ross. You probably covered it. It was about waiting lists. We know mental health was cut to the bone before COVID, so it's going to be even more struggling now. Waiting lists, I'd heard waiting lists for CAMS was up to about 18 months. How is that sitting just now? What is the kind of waiting from referral to treatment?
So we're sitting at I'm going to say 74%, but I'm just going to double check I've got that figure right in my head. I don't have the October figures yet, but the September figures, where CAMS it was 75.61% within 18 weeks. So we're not back to where we were before COVID, but certainly made a decent dent in terms of recovery. And psychological therapies was back up to 69.41% against the 90% RTT target. So that's around 18 weeks from referral to treatment is the national standard. So we're certainly seeing an improving picture and a recovering picture within mental health services, but it will take some time to get back towards the national standard.
No. Okay, Angela.
Yeah, could I come in again?
No problem.
Mental health, I think we always focus, well, we don't always, but you're thinking about younger people and how it affects them. And I think a lot of the elderly just now, and I know there isn't much that can be done because of COVID and staffing levels and whatever, but the elderly that went to day centres, went to their lunch clubs, these things were all put in place to keep their spirits up, to stop depression, to keep them kind of going. And they seemed so important a year ago. And now, well, I'm seeing it kind of firsthand, going in, visiting most of my patients are elderly. You can see their mood has dipped. And it's no a criticism, Ross, because we're in unprecedented times. And I know it would be difficult for you to say when these would be up and running again, especially with what's happening today.
Yeah, I think Morag will pick up in later reports as well.
The next item, yeah.
But I think it's just it's a very difficult position, first and foremost, around the fact that we know we can't open our day services back up as they were just now because of the risk of COVID. It would be too difficult to do so with the current rate of infection. And I suppose what we have been doing as for assurance is then taking a person-by-person approach to identifying what supports we can put in. So it's very different. It's not in the same basis as it was previously. But I suppose what we do have, particularly in younger adults, is quite a significant experience of moving away from a sort of day service approach to much more sort of person-centred and individualised supports for individuals. So we've been trying best to use the same methodology for older adults as part of this through COVID, just because of the fact it has been impossible. And I suppose just one last point on that is we've then got our weekly care home assurance group, which is looking at care homes, etc., through COVID and care at home services, and that includes public health director, nursing director, chief social work officer, chief officer, etc., etc. and we're using that forum as the means of getting the health protection advice around when it would be safe to make changes to, to any potential reopening of that type of approach. But certainly the public health advice at the moment is that we certainly couldn't do so as it stands with the level of infection in Lanarkshire.
I think we touch on that in the next one where we get that word balance of care, and Morag will get that in more detail. You okay with that, Angela? That then takes me on to Agnes McGowan. Yeah, Agnes.
Hi everybody. Hi Ross. An very proactive, which I think is definitely the way to go. I'm very interested in the Lanarkshire Green Health Partnership. I think it's doing an amazing job. And I don't know whether you've heard of the project in Edinburgh, whereby Edinburgh doctors, GPs, are prescribing a visit. They're working in partnership with the RSPB in Edinburgh, and they're prescribing a visit to the reserve. They're actually handing out a brochure to people to visit the RSPB, and they feel that is having an effect on mental health and anxiety. The warden in the RSPB in Motherwell, Barnes Hoch, is very interested in this project and is looking forward to seeing the results of it, and hoping that if it's successful, he can maybe think about that in the Motherwell area. So I think that's very, very interesting. Yeah. And I'm also working with the community in Ward 19 and the Health Board on developing the dementia support gardens in Finlay Street in Motherwell, just at the Earbles Road Centre. They were made a few years ago, but unfortunately they've been allowed to get a wee bit overgrown. But there's a team working there to get them into order. And there's local schools, Fir Park Secondary School, Dale High Rugby Club, local primary schools and Motherwell South Church are going to work in a team to try and develop different activities in these dementia support gardens. So, I hope that will also help with some areas of mental health too. But I'm interested in that. And my question, it doesn't relate to that, is four care homes have been identified to test the All of Us programme. Can you give me a wee bit of information on what the All of Us programme is, Ross, please? Thank you.
I'm going to ask Morag in case Morag knows this. I'm not 100% sure on that one. We've got a range of programmes we do it in conjunction with Scottish Care. So we've got a range of physical activity programmes, etc., that we've been rolling out across. We've been one of the sort of national pilot sites for some of that work. And I'm not sure if All of Us fits in with that one or not. Morag, do you know more than that one?
Is it not in the attachment, the full detail of it? I mean, there's a connection there, the full report, Morag. Am I right in saying that? The All of Us.
Oh, so it is.
Yeah. I was reading this again last night, Agnes, and I noticed that I thought it might have appeared in the papers here, but there is an attachment there that gives.
Yeah.
It's on page referred to on.
So this is then picking up into the. This is the bit I was talking about earlier. I didn't recognise the name. So this is the staff health and wellbeing programme. Yeah. So it's then extended out into the care sector as well. So in regard to that, there's a number of resources that are available to across the board for all staff. So that includes the ability to phone. There's helplines in place for staff to phone and get confidential support around mental health and wellbeing. We've also got breakout rooms. So we've got safe spaces and quiet spaces for staff set up in care homes so that they can go and get 5 minutes away from from all the challenges that are taking place. And there's a whole range of psychology supports, etc., that have been pulled together for staff. So that's just the staff mental health and wellbeing strategy that I was talking about, but just being pulled together into the care sector.
Morag, do you want to add anything to that?
Thank you.
Is that okay, Agnes? You're not, and that attachment, obviously, I think it's quite detailed. Morag?
Yeah. I was going to say, in terms of the care homes, obviously it's limited to a number of care homes. It's all of them, but there's different engagement depending on where they're at and what they are looking for. So it varies. The response through all of us varies according to the works for particular care homes. It's good that the offer has been made across all of the state.
Okay. You got most of that, Morag. I don't know if there's something wrong. Agnes, you okay with that feedback on that, with the content that's in the report and with the attachments that maybe give a lot more detail on this?
Yeah. Sorry, the attachment. I obviously didn't read it properly. I would give myself a bad mark for that.
But there's actually two. There's the Community Solutions Annual Report, and there's the All of Us staff, which you refer directly to they're attached the support programme. Is that okay?
Yes, that's perfect. Thank you very much.
Thanks, Agnes.
Thank you.
Go to Claire Bartley. Thanks, Claire.
Thanks, Tommy. Again, a really good report. Thanks a lot for this, Ross. I think you're really at the sharp end. And once again, we can't thank you, the staff, yourself, the team, and all of the staff that are working within the adult health and social care part of everything. I'm really interested in the new referrals, going through the system of the Near Me, of being able to speak to the consultant, and like so many other things where we've had to adapt and learn because of COVID, and there's not many sort of lights that have came out of the COVID situation. But as a phrase my gran used to use quite a lot was, when sort of the devil, because if something comes, you've got to deal with it. So is this something it's because we've had to do it for COVID? Is this going to stay? It's about not using it because we have to, but seeing that it's actually been a benefit, that this is the new way of thinking. Because if it's having the kind of results at the moment of being able to signpost people to the right place at the right time, as well as bringing the waiting lists down, but it's going to help the folk that are contacting us, is that one of the things you could say, right, that's actually going to stay? It's not just solely to COVID.
Yeah, it's right saying that's the paradoxical unintended consequences of COVID.
Yeah, I mean, and I suppose that's been the whole approach of recovery in the partnership and across the council in general as well. That we're trying best to learn from what we've had to put in place, and there are elements of this that won't go. So if you look at the sort of, we've talked about the sort of mixed economy of sort of face-to-face, near-me type approaches. I think that's here to stay, that we already had a planned rollout of near me. This is just accelerated at 100-fold, out of necessity. But we always had that plan. And if you look at the same as the rollouts of things like Teams and all the rest of it to allow remote working, we're not going to go back to the way of having. I'm not going to go back to having my management team of 35 people crammed in a room, driving from all over the county. That's never going to go back to that. We know we will continue to have that on Teams. It will take half the amount of time, and then cover all the travel expenses associated, etc. So that's the sort of place we are. And again, the bit around some of the consultant triage, that was coming through already as part of the request through the national service model that we hadn't implemented yet in Lanarkshire. But again, this has forced us to do it much more quickly than we'd previously planned. But I think that there was a lot of anxiety within the clinical team around it. But I think they've very, very quickly realised it's been incredibly positive. So, a lot of learning. And I suppose that's what the recovery plans that we're submitting back to government are trying to best set out in terms of the developments we've put in place and what we think will keep, that will make a significant impact going forward.
Claire, it's a detailed answer. Maybe Alison will touch on it when she reports on retrospective of last year's report, annual report, but it touches on the notification, was it in September, of the review of adult health and social care vis-a-vis in relation to COVID and how that goes forward.
Yeah, thanks a lot, Ross. Thank you.
No problems.
Ross, can I just say that I've been listening to the questions there, and I know we went over this in detail at conveners, but can I say that there's contents here that relate to staff, but particularly that one of community capacity building. And I think as elected members we're all aware that there's the new forums in our areas are still to be put into shape, and we're still working on that. But I think it's important that rather than us just getting this every seasonal, once every 3 months and coming here, that we get something. And I'm not instructing conveners of those committees to do that, but we bear that in mind, certainly in relation to community solutions and community capacity building, that we bear in mind that we'll need to get something decentralised back into the likes of the Cumbernauld area, the northern area, the Airdrie, the Coatbridge, the Motherwells, and all those 6 fora that are presently being formulated. If we could bear that in mind for a report in the future.
And the reporting is all constructed in that manner from localities, so that won't be a problem to be able to pull that together.
I think everybody would agree that that would be helpful, because that takes it specifically back into our own backyards, without being too parochial about it. But at the end of the day, that's who we answer to. Okay, colleagues, can we agree then that positive report and trying our best to keep things going? That will be noted, and that we take the recommendations as outlined in page 5. Note the report. Note the flexible dedicated community solutions, and Ross will see about decentralising that further. And note how the staff health and well-being will be developed and progressed, taking on board the comments that have been made today. Can we agree on that? Thank you then.
Convener, before we move on to the next item, can I just inform the committee that at the start of the meeting I said that Councillor O'Rourke has submitted his apologies and Councillor Rorty was here as a substitute. Councillor O'Rourke has now joined the meeting, and obviously both members can't participate if there were any votes. So I understand Councillor Rorty is going to leave the meeting. I just want to let you know that.
Okay, right, okay.
Thank you very much for that, Andrew. Thank you. Bye all.
Thanks, Eloise.
Bye.
Bye.
Convener.
I heard the voice there, and that is Councillor Rorty.
No?
Councillor Pettigrew. I'm Nancy.
Yeah, I'm here. I just heard that we're amongst both North and South Lanarkshires going to Tier 4 on Friday. Stirling's included as well.
Well, you know, it's I think if I like a punt, as you know, but the bookie wasn't even getting any offer on that sort of thing. You know, I mean, I thought it was a one-horse race, that, Nancy, but that confirms it.
Yeah, there's quite a lot, Tommy. It's going with us. Well,
it's Friday morning. I mean, it'll be interesting to hear, you know, if we've got group meetings next week or whatever, the consequences of it. But
yeah,
presumably Glasgow ourselves, the 2 Lanarkshires and round about the Clyde Valley. Well, I think we knew we were heading that way. The surprising thing for me is it's Friday morning. I mean, as a former teacher, I mean, that's chaos again on the Friday, but we'll not go into that debate. I see Frank's here, and Frank will probably be sitting rushing away early to deal with that for the schools. That will be up in further chaos come Friday if we're getting into albeit the schools are supposed to be in. The teachers travel now and so on and so forth. Thanks, Nancy, for letting us know. We'll go back to our own problems that obviously will impact on things, how we operate. And if we could take the next item on the agenda, touched on there were some of the items that maybe are fleshed out a wee bit more in this item, how the whole system approach and keep a positive balance of care is detailed out in various areas here. It's interesting as well, and Morag will take us through that. Thank you. Morag.
Thank you. I think my connection is not perhaps the best this afternoon, so I hope you can hear me okay.
A lot clearer now, Morag, than it was first time, yes.
Good, thank you. This paper is to bring to committee the kind of range of things which support North Lanarkshire's positive balance of care. We know that both locally and nationally, North Lanarkshire has got a strong reputation in supporting people to live at home, live well at home and live safely at home rather than in institutional settings. And this paper sets out the range of work that is in place routinely to do that and considers some of the impacts in relation to responding to COVID. As Ross has already said, a significant focus of our response to supporting people is individualising and making sure that arrangements work for people uniquely and for their families. And it's fair to say that this approach has helped us significantly through the response to COVID as well. Some services have continued with little change, albeit are part of modernisation like home support, and others have been subject to much more significant change like the support in day centres. But all of the been done with the focus of public safety, staff safety, and following the Scottish Government route map and individual risk assessment. So the first one that's outlined is the change to respite and short breaks. We recognise how important it is for people to get the opportunity to have a break from routine caring, and how difficult that's been over this period. Any of the buildings-based respite, so residential respite, is subject to people being in isolation for 14 days. So it makes residential respite not really the most desirable option for the majority of people. So most people have preferred to receive some support at home. So I'll come back to that. But FEW, which is the respite service for adults with a learning disability in North Lanarkshire and Motherwell, has got capacity for 14 people, and we have, through negotiation with them and their active participation, repurposed that a bit to reduce the numbers to 12, which means that each person that would use it has got their own room, obviously, but sole use of ensuite facilities as well, which makes it a more appropriate COVID safe environment. So that has continued to provide individual respite for the small number of people that want that, but it's also supported people to be discharged from hospital where it's not possible for them to go straight home, or in a small number of cases where people have gone to FEW for a period before going on to a nursing home. Which has meant that we've used the expertise and skills of the workforce appropriately, and I think they've enjoyed the wider range, and people who have used the service have continued to enjoy that. Obviously will be in new negotiations in relation to timescales, but that will continue in that model for the foreseeable few months. Planned date of discharge, which is the next thing, is really about making sure that people are in hospital for as short a time as possible, because recovery and rehabilitation happens better at home. And we know there has been criticism in the past from particularly family members who feel a bit frustrated about not being involved in the discussion and not anticipating a date of discharge, so it all feels a bit of a rush at the point that discharge has been made. So planned date of discharge is really shifting to a position where right from the point of somebody being admitted or as soon as possible thereafter, we're agreeing as a whole team approach. So acute colleagues, community colleagues, nursing, social work, but most importantly the person and the family members as well, agree what date we're working towards for discharge, which means that arrangements can be put in place proactively for any support that's required or any equipment that's required to facilitate that discharge. I think has already been discussed in relation to the value of Near Me. This piece of work is supported by a daily call, so at 11 o'clock every day, each of the 6 localities and the 2 acute sites, Hairmyres, Monklands and Wishaw General, are involved in a call which keeps the track of the planning around individual people and ensures that that's progressing smooth. That's really only possible because of remote connections. So people link up for half an hour, 40 minutes, and that is a very productive call. And you'll see from the last paragraph there, 2.9, that we've significant shift in the figures, which means that we're now around 60 people who are waiting for discharge, where in the past that's been almost double that. So that's a very significant improvement, and we expect that to continue as we roll planned date of discharge out to other aspects of hospital and other wards. The integrated rehab teams support that work as well. The availability of rehabilitation and support in the 6 localities in people's own home has been one of the kind of real flagship developments of the integrations arrangements, and has seen the use of Near Me very significantly support people through the pandemic, particularly people where there may be priority 3 needs. So not the face-to-face is important, but can be done through Near Me rather than actually in people's own homes. So it's continued a kind of whole system approach to the response to people. Individualised budgets and self-directed support, by its very nature, is more designed around what works individually for people. So it's been a bit more straightforward to maintain these services during the COVID period, and that's been supported by weekly conference calls with the providers of support to ensure that we're approaching any problems arising or any learning or shared information together. And we also use a red, amber, green process in terms of ensuring that people individually are getting the right levels of support, and that continues to be checked on a weekly basis to respond to changing circumstances. Support through the day, as we've already talked about, the risks of bringing vulnerable people together into a shared environment has meant that we've seen probably the biggest change in relation to the delivery of the support model, where the staff have all been supported to receive the tech that they need to work remotely, and risk assessments in relation to individualised support means that there's a lot more outreach and support at home to offer that break from the significance of providing a caring role, and also to make sure that people's quality of life is maintained in terms of their wider well-being. The development of some of the response to that, I think, has also focused on ensuring that people have the tech to be able to do that and link in, which links to the next point, which is support to carers. And our relationships with independent sector providers has meant that we've seen a significant shift in their response to be supporting digitally and to do a lot of outreach to make sure that people have got the connections and the support that they require to continue their caring role, and the providers have been really excellent in working flexibly with us around that. The report at section 3 notes that there is an independent review of adult social care, which the First Minister announced, and that's due to be concluded by, or due to be at this phase of it concluded by the end of January next year, which is a very tight timescale, and that will be subject to further reports coming back through committee and the implications of that. The report, I think, is just highlighting this range of things, not as exclusive, but as important elements of maintaining the balance of care. Happy to take any questions.
Those items developed were touched on with 2 or 3 questions earlier, such as the carers is going to come up in further detail in the next report, and the independent review. Alison will touch on that in more detail for the annual report. If there's any points, it's a very interesting how the department and people have adapted, and certainly IT has been a saviour in this instance, albeit that it's not a total one or the other. I think the ideal word here, if we agree on the report, is it's the balance of care, facing the practicalities that face the department on a daily basis as Morag developed the logistics of dealing with this. It's getting that balance of care and bearing in mind the government guidance that's placed, the 14-day isolations and so on and so forth. Things can't continue as normal. But I think the report flags up that it's all shoulders to the wheel here, and it seems to have kept things afloat and developed. As you were touching on, Claire, developed in some areas that possibly weren't even thought of beforehand. Can we agree to note the report, or are there any questions you want Morag to give further information on? If you're all happy with it, I mean, I don't think there's any problems in any of the areas. I think we can agree to note the report. And there's one aspect of it there that was in the report, and that's the carers. A very interesting report that comes up next. But can I formally ask that we agree to the recommendations on item 3 to note the report, and there will be obviously further reports coming back, not least on these areas, but other forums will see the updated report as Alison and the team work on it to submit it to the Scottish Government on adult health and social care. So if we can agree to those 2 recommendations, which are outlined in page 13, that would then take us on to the next item, which is the further development of the carers, progress of the implementation of the Carers Act. Another heartwarming report here, and it's also Morag that's going to take us through this. Thank you. Thanks, Morag.
Thank you. Thank you. By way of background, the Carers Act required local authorities and health and social care partnerships to particularly focus on the provision of adult carer support plans, young carer statements, the provision of the production of a short break statement, and a focus on carers in the process of people being discharged from hospital. So you'll see that a lot of the reports this afternoon are linked to each other, and some of the developments already described help with the implementation of other parts of the work. And in March 2019, the commissioning process was concluded, where direct support for adult carers is provided by Lanarkshire Carers. The campaigning support and information and broader advice for carers is provided through North Lanarkshire Carers Together. Young carers are supported through Action for Children Young Carer Service, and the Community Solution Programme supports the opportunities for carers through Voluntary Action North Lanarkshire, which again has already been mentioned. I think you'll realise there's a theme to a lot of the discussions, because much of the response from the independent sector providers has focused really on changing to digital platforms and doing outreach and connection with carers in a much wider range of ways, but ensuring that that is done digitally. And that has allowed for important aspects of people's care to be recognised in relation to coordinating the support and service people get, where people feel that that has been correct, or that there's been some adjustment to that people have needed support with. The carers organisations have done very well in identifying that and working with carers themselves and with statutory services. Access to PPE for carers, which has actually been quite a big issue. The carers organisations have been particularly helpful in doing that as well, and making a surety really that practical arrangements are in place. You'll see I'm not going to talk through all of the detail in the report because it's long and detailed, and hopefully you will have enjoyed the information in it. But I think in terms of the response to children, you'll see that children as young carers, there's been quite a focus on connecting through digital platforms using Zoom and things. But I think it's nice to see that a lot of the focus of that has been on people having fun and enjoying some lighter moments as well, which whilst we can't always give people a break from the routine of caring, breaking the kind of feel of things being hard work all the time is an important aspect as well, and being able to connect through enjoying and having an opportunity to laugh is important. some nice examples of like Rascals and Parkinson's North Lanarkshire, ensuring that there's strong and active contacts with people. Often that means people that they've got good established relationships with as well already, and people that are maybe new to that, and identifying new carers has been the focus of that work. We have re-established the Carers Strategy Implementation Group, which was paused as a result of COVID, and that will be an opportunity, as Ross described earlier, to really review what's worked through this period, what we would want to hold on to, and what we would want to embed in the future. And obviously, we will be doing that work with carers and people with lived experience as active partners in the process.
Thanks, Morag. I would say that under normal circumstances, this would be an ideal opportunity to bring the carers, some of the representatives of this report, and speak to committee. But because of the circumstances that we are under, that is something that will be taken on board in the future. It's certainly a heartwarming report, and certainly for myself, it's most comforting to see the role that the young carers in particular play in the overall provision of this particular service, and the detailed report at the back makes an interesting, heartwarming read. But I think it's nothing but successful in that particular area, and I would encourage everybody to certainly read the attached report. I know there's various stretches in our time, and it shows just how well we're doing. To the extent, I think we got the highest award in Scotland. Is that right, Morag, for the highest award in Scotland for the short break?
Yeah.
Short break money. And we must be doing something right when we can see things like that localised in our own services. If we can agree to note the recommendations in the report, and as I said, it would be a proposal that someone would. Sorry,
Councillor Barclay wanted to come in.
Sorry, I see it now, Claire. I was trying to elicit or encourage you.
Not at all, Tommy. And it's just a quick comment, just to thank Morag for another really good report. And I think that just to echo what you've said, Tommy. I think the work that has been done on this side is just exemplary, and it's good to see. Obviously, biased on my side from the Cumbernauld side, but to see people like Rascals and Watch It Grow get specific mentions in there. But thanks, Morag, again for the work that's getting done.
Certainly, there's not long left of the administration, but it wouldn't be squeezed into a committee. We would get an organisation list to come along, and it would be all members would be encouraged to, and certainly we would try and squeeze that in before 2022, because these are the people that deliver in their daily on a regular basis that don't get the recognition, that we formally give them that recognition. Thanks very much, Claire. Okay, we agree to note that recommendation then, and that we note the report, and look forward to further reports and representation at the committee. Claire, I'm normally quite on the ball with my words, and I said unforeseen circumstances. I said unintended consequences of COVID. But as I turn to the next item, it should have been unforeseen consequences of COVID. And I think this is an area that, ironically, will be a burgeoning area, is the development of qualifications for the Care Academy. Not within the Care Academy, for care itself. Very interesting report. But I'll now ask, is this yourself again, Morag, to take us through the developments there in our Care Academy over in the high school. Thank you.
Yep, thank you very much, Convener. Again, this is a nice report to bring to provide an update in relation to the work that's been done around the Care Academy, which, as you would imagine, as a result of COVID, has been slightly interrupted, and the timescale has perhaps stretched a bit, but nonetheless, the focus of the work remains, and looking at how we do it slightly differently has been the focus. So the Care Academy essentially is about making sure that across health and social care, that the future workforce in North Lanarkshire builds on local people and encouraging people to enter or progress in a career in relation to health and social care, developing local opportunities and valuing local people. It recognises that the workforce will be challenged over the coming time in relation to a shortage of skilled staff, and recognises that with the growing number of people living longer and living with a multiple of conditions, that the need for a skilled workforce will just continue and to grow into the future. So the strategy really does two things. It tries to promote health and social care as an option for people in terms of jobs for the future, but it also looks internally as well to ensure that people within the system are getting the opportunity and support to progress and promote within the jobs that they've got. So it kind of acts at both levels. And as I said, it's making sure that we do have an eye to the future in relation to skilled workforce. And within that, I start to address some of the issues in relation to inequality and deprivation, whilst also promoting fair work practices and developing career opportunities. So a number of key things which have happened already. Coltness High has been the high school identified as the Health and Social Care Academy, but as a first round, not as the end in itself, and the learning from that has been very significant in relation to the numbers of people interested in care as a future career, often from a position that people don't necessarily know what it is before being introduced that way. The Care Academy portal, again, has been introduced to ensure that there's easy access to information where people have got opportunity to look at real people's stories and examples of what career choices are possible and what that might mean, and participation in recruitment events, which have been real where it's possible, but the ones that will be coming up in the future are likely to be online, and the feedback from the events so far have been really positive. So again, without talking too long over the detail of the report, happy to answer any questions.
Thanks very much. An excellent synopsis of a burgeoning area of future employment and careers for our young people. If there are any questions on it, I mean, I'm surprised that you're not asking, is it going to develop out from Clyde Valley? I know it was discussed in some detail there. That certainly would be the intention. But when you consider that this only started was in 2018, as it's contained within the report, and how far it's come just now, it will be an area that will grow, that will develop, not least because of an ageing population, which is the original reason for us having it there. But COVID is certainly a multiple factor in that. Am I right in putting it that way, Maura?
Yes, I think probably we recognise that COVID can do two things. One is that it brings almost a highlight to the need for people to work in the sector, but it may also bring a bit of fear. So I think that we need to make sure that there's a positive sharing of information in relation to what the opportunities are, so that it combats some of the fear and perhaps reluctance to consider that area of work.
Okay, so we'll agree to note then the positive work that's being done there, and no doubt in future these will be reports that will be further information in them, because they will develop. They will develop. More and more people will be asking about it, and will be deciding that is where the future career lies. Agreeing to note that then would take us on to item 6, which is something I've already touched on, is Alison's the annual report of the Chief Social Worker. Social Work Officer, not social work, Social Work Officer. It's quite a detailed report that has to be done every year and sent to the Scottish Government, and Alison will outline the salient points within this detailed document. Thanks, Alison.
Okay, thanks, convener. And apologies, my connection also seems to be a little bit problematic this afternoon, so please let me know if you lose me. So I'll try and be relatively brief. As you say, convener, there's an obligation on the Chief Social Work Officer to provide an annual report as part of their duties to Council and also to Scottish Government. So I'm seeking your approval today. Also, this report will go to Education and Families Committee, given that social work also falls within the remit of that committee to endorse the report, so that it can then be finalised. It's a retrospective report which covers 2019 to 20. So some of the content of the report members will already have seen. So for example, in relation to our statutory responsibilities on adult protection, we had quite a full report at the previous committee on that. And also, because I'm later on in the agenda today, some of the developments that you've heard about from Ross and Morag are also covered in the report. So I'm not going to repeat material that's already been covered, but happy to pick up on any of that. There's a standard format for the report. It's been updated, shortened slightly this year because of COVID. And there was a request, obviously, that we provide a bit of information on the impact on service delivery of the pandemic and what that's likely to be going forward as well. And again, some of that you've already had before in a previous report to committee, but I'll maybe speak a little bit about the looking forward piece at the end. In terms of the governance section, a lot of that has not changed hugely since last year. Obviously, further work has been undertaken to disaggregate the different elements of the social work service and to integrate further within new service arrangements. In relation to planning, you're already aware that one of the major issues around for adult services has been the development of the new strategic commissioning plan. In relation to public protection, as I said, you've heard about adult protection before. It's maybe worth pointing out that there has been quite a lot of activity around domestic abuse being undertaken over the last year. Work being undertaken in justice services to strengthen our response to those who are convicted of domestic abuse offences, and integrated work within children's services around the response to victims and children affected by domestic abuse. As I'd said before, a lot of the work, a lot of the developments around carers and adult services you have already heard about today. The report does contain some specific detail about the delivery of statutory functions as well as public protection in relation to adult mental health, welfare guardianship and statutory activity around the Mental Health Care and Treatment Act. And you'll see from the figures in the report that that continues to increase year on year and place additional demands on the service. The budget information contained within the report is fairly brief because, again, that's an area that you will have had in different forms fuller information about, but tries to give an overview of the resourcing of social work services and some of the key pressure points and how we're trying to address them. What probably is new to members today is the section on workforce planning and workforce development. And hopefully that will give a bit of an insight in relation to how we develop the workforce within the service and how we plan. And again, Morag's touched on it there just now in terms of the Care Academy, to make sure that we have appropriate staffing across the different areas of service activity. You've heard, obviously, during the year previously too, about new approaches to the recruitment of mental health officers, because that's a bit of a pressure point for us as the service. And what's also highlighted is some of our activities still in terms of recruiting and retaining social workers, in terms of growing our own and our senior practitioner scheme, as well as some of the training and post-qualifying work that is being undertaken within the service. The final section of the report does deal with the impact of the pandemic. The information contained within the early impact. Sorry, my dog's just gone for a drink of water and is very loud, so you will be hearing it. It's not me slurping in the background. So you'll have heard some of that before previously in relation to some of the ways that we've had to reconfigure services and our response, and the initial decrease in demand for services, which has then further increased. It's probably worth spending a minute or two just on talking and looking forward. You've heard about some of the new ways we're configuring and delivering services. We will have some degree of backlog in demand for services for some areas going forward, and a lot of that relates to links with court-based activity. So where, because of the impact on the courts and children's hearing system of the pandemic and the reduction in business, there's a lot of demand that is still coming through that's been suppressed over the piece. So a challenge for us as a social work service, as things hopefully begin to open up again, will be to manage that demand alongside our existing commitments. We obviously also do need to prepare for new need arising from the pandemic, whether that's related to the impact in relation to poverty, mental health we've talked about earlier, and other new demands as well. And you've heard too about the amendments we're making to service delivery in terms of hybrid models of practice. One of the challenges for us as a service, though, is that there are elements of social work that just have to be delivered face to face, and we need to find ways of doing that. That we deal with sort of complexities in people's lives, complex dynamics, and there are some things when we're talking about life-changing decisions for people that people want us alongside them and talking to them about, and that's something within the new context that we still need to build into our system going forward. Similarly, one of the things that's been, I suppose, highlighted during the pandemic are some of the weaknesses within our current case management system, and that's another area we're looking at to try and ensure that we have a modern system that supports us deliver and measure outcomes in the best way possible. In terms of policy changes and developments that are going to impact over the coming year, you've touched on several occasions already today that probably the biggest for us is the review of adult health and social care. Clearly, part of the prompt for that has been a query about whether or not the landscape of provision is right going forward in the mixed economy. But I think it's fair to say there have been some concerns nationally too about inconsistent sort of levels of support provided across the country. There's some tension between, I think, a drive for consistency and the need to develop or deliver support that's personalised, which has always been, I think, something that we felt's been a strength of our practice locally. I think the concerns have stemmed more from people's concerns about levels of support and care than other areas of social work support around mental health, addiction and statutory practice. So the focus has been more on care packages and people's rights in relation to their care. And it's quite important that obviously that is considered going forward. We'd very much support that. But the review will also, I think, ask hard questions about, is there enough resource in the system to deliver on the aspirations of what we want for an appropriate social work and social care service going forward. We will engage with the review both in terms of the response. The review team have engaged with chief officers, chief social work officers. We've got a chance to respond, and we do have engagement coming up actually with the review about delivering ethical care within Scotland, and they want to speak to us about that as well. But as Morag had said earlier, we clearly will be reporting back as that progresses on the impact for us locally. I probably don't want to say much more about the report than that, because a lot of it you have heard before in other reports, but I'm happy to take any questions in relation to it.
Thanks, Alison. Alison, it might be helpful just to clarify, including for myself, because I know when we got the papers at conveners prior to coming to committee, the report was in draft and it had to go away that weekend to the Scottish Government. But putting aside the review of adult health and social care, which is, almost a standalone item and forward-looking, when we submit this report to the Scottish Government, could you clarify for members and myself, what's the next step? Do they do a review of all local authorities? And I know this is to go to children and families. And do they come back with their information on that? Because it might be helpful for members to know salient points within, and just wait on that particular stage. The Scottish Government might come back and highlight areas that they want to flag up.
Yeah.
Would that be the case?
The process is that the reason the report's marked draft is just purely because until it has committee approval, it remains a draft. So although it has gone to Scottish Government as requested in draft form, they wait for confirmation to see that it's been through due council processes, because clearly the responsibility for the Chief Social Work Officer is primarily to council. So that's why it's still marked as draft. What they do with it, it goes to the Office of the Chief Social Work Advisor, and they have some researchers who look at the 32 reports that will be submitted across the country. They pull out themes arising from that, and they produce a composite report, which is circulated widely within government. I'm not sure this year whether, I don't think there's a formal process linking that to the review of adult health and social care, but it clearly will be of interest in the context of that as well. But it helps, I suppose, that the thematic report really looks at what are the issues that are emerging across Scotland as opposed to local issues, and that obviously informs other discussions in government about policy and practice in relation to social work.
And we will get, as a committee, that will come back down the way, so to speak, and a summary or a reference to that will be made within subsequent reports in the next year, in 2021-22.
Yeah, there's not a process whereby it necessarily comes back formally, but there is no problem. You know, it normally takes a little while for that to be collated and returned, but there's not an issue with referencing and sharing the headlines for that as we go forward.
Yeah, colleagues, Alison, having clarified that point, I think that it's certainly a report that we've discussed on every committee on the various items. It's a summary of all them. So my suggestion would be that, you know, it goes to government after it'll go through Councillor McNally's committee. It goes to government, and we take the time to peruse the reports, the documents, and see what comes back, given time, when they come back with those referral points, and we can keep an eye on when that comes back, presumably within the next calendar year, or maybe more because of COVID. Is that okay? If we could agree then to note Alison's detailed work, approve the report, and agree and note that it is going to Education and Families, presumably for approval through Frank's committee there at the Education and Families Committee. Agree on that? Okay. Thank you very much, colleagues. Taking us on very quickly to item 7, a few areas touched on earlier as well, Ross, in this area. And it's obviously COVID impacted, but it's the performance report, item 7, Q1, which is totally for the year of COVID, or it starts almost when the COVID kicked off, overture into the Grand Opera. Q1 performance report. Thanks, Ross.
Okay, thanks, Convener. I mean, as you say, I think this one is particularly Q1 of this current year has really turned a lot of performance indicators on their heads. So we jump to Appendix 1. I suppose focusing on the sort of reds and ambers, we've had a reduction in terms of the numbers completing the enablement process. And that was simply, I think, as a result of the issues we had around Q1 around COVID. It's a particularly strong COVID impact. And as the narrative covers in terms of enablement, we still were able to maintain the numbers of people who are going through the process in terms of new packages, starting with enablement services around 74%, but obviously quite a significant reduction in the number of new packages starting. I suppose a couple of impacts there around the reduction in terms of hospital admissions and hospital discharges, and also secondly around the fact that a lot of people were trying their best to reduce the traffic through the house. So we're not keen on bringing in additional packages of care, etc., over that time period, just due to the risk of COVID being brought in. The next one, moving on around complaints response, that's seen a sort of gradual improving picture over the course of last year and then into this year again, jumping up to 73%. So it's still short of where we are looking to be, but we've continued that sort of gradual upward trajectory on that one. The care home average length of stay was slightly longer at 984.7 days. But I suppose how this is calculated is based on discharges over that quarter, and it's basically based on the average of that quarter in terms of discharges. And I suppose for assurance for the committee, we've been doing some work on the national data, which I actually think we should bring to a committee coming forward, actually, because it's an incredibly positive picture for North Lanarkshire in terms of balance of care, where we sit, I suppose, as a benchmark for the rest of Scotland in terms of balance of care, in terms of community provision, and in terms of length of stay in care home as well. So we'll bring further data on that to the next committee. We were just reviewing that this morning, but some really important data coming through from the national figures that show the work that we've done over the last few years. Well, I'm saying last few years, but over a number of years in North Lanarkshire to get to where we are just now. Moving on to I jumped one there as well in terms of the equipment store. So the equipment store, in terms of the percentage of deliveries within 7 days, dropped to 65%, and again that was off the back of some of our staff shielding and just a whole wider range of issues around COVID that had an impact in terms of the service function. But again, that's an area that through a lot of recovery work we should see starting to come back up again in the next quarters as we've gone forward. That then takes us to section 7 around adult protection, and this is a sort of proxy indicator in terms of adult protection referrals that end up going to investigation, and I suppose the aim of it is to show that we're looking at 20% to show that the quality of referral is as high as possible. So it's a proxy indicator really, which is still sitting slightly low at 15%, and still sitting short of the target. But overall, I think the adult protection services and work has continued on very well through COVID. We certainly saw a reduction in terms of referrals at the very outset in Q1, but very quickly saw the numbers in terms of referrals and adult protection activity recovering back to where it had been pre-COVID by the time we got through to probably June time. And then again, the percentage of referrals that had got to a decision within 5 days is it should be green. It's at 71%, and again, I think just really demonstrates the work that had been done throughout the COVID period to make sure that we prioritise public protection arrangements throughout that time. And I think a great reflection in terms of the work that's been done by all the teams across the partnership, that was able to continue. And I suppose again, just for assurance, we also went to weekly meetings with chief officers, etc., around public protection, just to make sure throughout that period of the first wave that we were able to meet the statutory requirements throughout that time. So I will pause there and happy to take any questions as they come up.
Thanks, Ross. Just to clarify what you said there, you said you're going to come back with further information on a comparator for what areas, the areas that we have, although they're not in colour, we know the 3 that are red. The base areas on what you're going to compare with Scottish average.
So we've got a range of new data that's come out that Graham received in through the performance team, that compares the rates of admission to care home by age band across the whole of Scotland. It looks at the percentage and rates of individuals that are able to be supported at home through home support type services rather than care home, etc. And it shows, I suppose, North Lanarkshire up in an incredibly good light and being, I suppose, the benchmark probably, I think, for for the rest of Scotland, certainly among the mainland boards, around balance of care and supporting people through individualised supports in the community. So we've got a significant data set now that's just been released, the latest round of it, that compares us to every other partnership in Scotland.
So that'll be additional information on the report next time round.
So we can bring that through as a separate report.
That's great. I see Bob's on in. Bob, Councillor Burgess, thank you.
That's fine, thanks, convener. Ross, I see that the community alarms is still under review, but could you put my mind at rest on the charges for this, that there won't be any double charges per household? It was not a complaint, but some information I put in about 4 weeks ago, relating to husband and wife being charged for the same alarm.
Okay, no, that certainly is the case, and if we've got the details, if you want to pass them through to us, Councillor Burgess, we'll make sure that's picked up immediately. But absolutely, no double charging through that process.
Lovely, thanks, Ross.
It shouldn't have been. That's how we did address rather than individual. Ross, could you give us information on that? What was the feedback in that regarding the amount of, shall we say, lapsed or terminations?
I don't know, Morag, if we've got a sort of more up-to-date report on that one. Certainly, it was within projections. It was underneath projections at the last set of updates we had.
Right.
It was, and it's. I suppose it's a very current picture, because the letters went out informing people that we were introducing the charge, and so we had a few hundred queries in relation to particularly thinking about returning alarms, and there has been detailed individual discussion with people and with families about that. But this week is actually the week that people have received their first invoice for payment. So it might be more useful to the next committee to bring a bit more detail to that, because that's obviously another opportunity for people to think about it. Although the majority of calls that we have received have been about how to set up direct debits rather than to cancel.
That's good.
So, yeah.
But the reason I'm highlighting it is that we do need feedback on it. We know it's a sensitive one, but we want to ensure that everybody gets the chance to have the affordability measures that were promised within the communication that was sent. So it'll be interesting to see that when it comes back.
We'll add that to the agenda plan for the next committee.
Thanks for raising it, Bob. Is there anything else that needs highlighting other than the fact that would help with a wee, down the right-hand side there, 3 wee words, red, green and amber, you know, and it helps if we're not going to be able to afford the... Ross?
Apologies, we didn't pick that up through the conveners meetings. I hadn't picked on that. It was only today when I was reading that through that I realised that it hadn't been written in, so apologies for that.
Right.
Convener, Councillor Barclay wants to speak.
That's Councillor Clare.
Thank
Councillor
you.
Bartley, sorry, Clare.
No, Claire's fine. No, it was just to follow up, obviously, on the community alarms. And in the last committee, I was reassured and happy that when somebody was going to contact to say that they wanted to get the alarm taken away, there was a discussion. There was actually a conversation to try to ensure that there wasn't going to be somebody who was very, very vulnerable that was going to be left in a black hole if possible. So when the report comes for the next cycle, can that side be looked at as well to see if it's possible to give some sort of information on the number of people who called initially to say take it away but actually changed their mind? Maybe if whether that stat is taken or not, that might be more problematic. But just to give us an idea of how good being able to do that was, because that's been all of our concern, is that somebody who is very vulnerable decides that they're going to give up the alarm, whether it be on cost or principle, and that ends up that they're putting themselves into a very, very vulnerable position. Also, this review has been ongoing for quite some time, where it's about automatically people would be offered it if they were over 75. And then things have obviously changed in the interim, and COVID has had a big impact. and we're moving on. But is a full review being done into of whether it is need for an alarm or whether it is automatic for over a specific age? Is that still ongoing?
Ross, that human side as well as not just
Yeah,
statistics,
so-
but given that information that Claire's highlighted there, certainly
I
should be an
suppose
integral
importantly, I
part.
think the review of alarms was trying best to move away from just an automatic piece for a certain age group, because I think it discriminates in both directions, where there are some who think that there's absolutely no way I need an alarm. I'm fit and healthy at this age. And then there'll be others 10 years and 15, 20 years younger that are absolutely in need of an alarm. So I don't think age is a factor in it. I think it's about need. And I think that's where the important piece of this is that we undertake this as part of a complex assessment for individuals. And within that as well, we then pick up a whole range of other supports, including welfare rights, etc., as well as part of that process.
Great, a good detailed report on all those aspects, yeah?
Yep, so we
Absolutely.
can happily we'll add that to the agenda schedule for both those papers around the data and balance of care that we've got from the national statistics and community alarms.
Right, and take them separate from the performance.
Yeah.
Or the next
Thanks for
quarterly
that.
performance.
Right, very much
Excellent, Claire.
appreciated. Thank you.
Excellent. It gives us a deeper understanding rather than just statistics put in front of us. Absolutely. Excellent. Can we agree to note the content of that quarterly's report then? And that will be item 7 under monitoring completed, which will take us on to the finance side of it. We've got Thomas O'Hagan here. As we did before, and we noted before, we've put the revenue and capital budgets together under item 8. And Thomas, you can take us through that particular item first of all. Thank you.
Thanks, Convener. This is the Services Financial Monitoring Report as at 18th of September, which is accounting period 6. In terms of the revenue position, the service is reporting an overspend of £6.7 million, which is aggregated from net COVID costs of £8.1 million and an underspend in core budgets of £1.4 million. At the time when the accounts were completed, we only included COVID grant income when there was written confirmation of values from the Scottish Government. However, it is expected we will receive further funding through to financial year end, and this will be reflected in future reports. In terms of COVID costs, the main contributors are payments to partner providers, staff overtime, temporary staff, PPE, and the temporary delay in implementing some savings. These forecast COVID costs will continue to be reviewed through to financial year end, both in terms of actual costs incurred and updated government guidance and instructions to authorities. The underspending core budgets of £1.4 million is primarily linked to vacancy management, coupled with the instruction to all staff that offices should only be incurring essential expenditure. Turning to the services capital programme, there is an anticipated underspend of £500,000 against a budget of £2.5 million, and this is due to initial drop-off in demand for equipment and adaptations at the outset of the pandemic, coupled with the requirement to reschedule some house visits to comply with COVID health and safety guidance. I'm happy to take any questions, Convener.
Thanks very much, Thomas. COVID's well laid out, and the reality of COVID is well laid out in the figures that Thomas has presented us here in this particular item. Thomas, am I right in saying that the next cycle will see the impact of the decisions that are taken of what funding we're going to get from Scottish Government, and it might have progressed and clarified some of the uncertainties? Not that your figures are uncertain, Thomas, that's not what I mean, but the uncertainties of the situations that are in the report as it stands just now, because we've only reached this particular stage of the financial year.
Yeah, Convener, period 6 with confirmation of £6.4 million of COVID support. In recent weeks, we've had further letters from the Scottish Government explaining how they would reimburse some costs through to March. And those calculations are getting worked through in terms of what it'll mean, in terms of what we have to pay partners, etc. So there will be an update when this paper comes back.
Right.
But as I say, we will get more grant income through to financial year end.
Colleagues, if there's no questions on it, I know it's in a sort of limbo situation just now, and Thomas has clarified that we're getting further information back. it still makes interesting reading about just what we've been hot with, financially. And if we're okay to wait till the next time round when the position hopefully will be further clarified and a bit more transparent, a bit more clear, if we could just accept the recommendations on page 107 there, to note the outturn situations for the revenue and the capital budgets as they stand present for period 6. We could agree on that? Agree. Thank you. That would then take us to item, am I right saying this, Thomas? Item 9, it's a couple of contractual items that have to be noted to committee. The first one is a significantly sized one, the self-directed support interim contracts. If you could outline the reasons behind this, Thomas. Thank you.
Thanks, Convener. This paper outlines the actions taken during the COVID period by the service to extend one of the bigger framework contracts. The actions taken by the service have been done in conjunction with colleagues from corporate procurement to make sure all the relative legislation was being adhered to. And in terms of the decisions, the recommendation or the action taken to extend those contracts for 9 months was seen as best value at a time during, as I say, the outbreak of the pandemic.
So what would you say, the immediacy of the situation was because of the pandemic, but there's also the situation, Thomas, of trying to tie these in with the broader whole package, am I right in saying that, in time, which would obviously have the benefits of the economies of scale?
Yeah, the report highlights, Convener, that the service is going through, if you like, a preparing to get back out to tender for a longer term on these contracts. So this was very much a temporary solution that best fitted the prevailing circumstances at the time.
That's grand. Circumstances at the time, colleagues, which is noted, given it to us in front of it, as Thomas has outlined there. If we can agree to note that's a particular item and the recommendation therein, we can then take the last item on the agenda, which is the award of a contract below committee approval. Thomas, you want to take us through this one, please?
Convener, this again is a standard report that is prepared by colleagues in corporate procurement. As I say, it's brought in terms of standard regulations. I've got nothing further to add. As I say, it's standard information.
And we can see the nature of the services there. It's the advocacy services for adults 18 to 65. And I think we've already agreed in the last cycle the advocacy services for young people. I think that's a separate, but that's the specific one and why it has come here. If we could agree to note that and the accompanying financial information, the appendices therein. We agree to that.
Councillor Barclay has indicated she wishes to speak.
Claire, thank you.
Yeah. Sorry, Tommy, me again.
No problem.
No, I don't have an issue with this one at all. I just, again, to put on record of how important the advocacy service is. I don't know how many of my colleagues have dealt with the advocacy service, but I've dealt with them now on a number of occasions, and the work that they do is invaluable, because even when the person is not in a position to be able to help themselves, they still have somebody who can advocate on their behalf while they're going through that particular troubled time, and it means that they're still covered. So I think it's really important that we do engage with an advocacy service, because I know for the person how important it is, but also for the council departments, whether it be social work, housing,
Absolutely.
Finance, or whatever, how important it is. I just to put that on record. But thank you for that.
Absolutely. I mean, it's a service that, and Maura get touches on that area of an earlier report that you've got for bereavement. Was that strategy that was developed recently for the short stay of bereavement, the development of that?
I mean, I think in terms of all of the reports really that we've talked about today, the importance of advocacy services cuts across it all. And I suppose it's interesting having it today because we have got slightly separate arrangements in relation to ensuring that carers are supported with their voice and that service users are supported with their voice. So you could actually see a circumstance where in a discussion there would be two representatives, one standing with the person and one with the carer, so that both have got the opportunity to be supported with their viewpoints. So it's an absolutely crucial bit of the whole picture to make sure that inequality and vulnerability is protected.
Absolutely, Monique. The whole picture is a mosaic of the various services that every officer has spoken to here today. And under the prevailing circumstances, our thanks and our appreciation and gratitude goes to everybody who's gone through all this at present. Everyone is, in our various ways, trying to take it from the elected side, the officer side. And I say it's been a pleasure to have chaired this today and hear the feedback. If there are any problems, it's interesting the amount of problems that came through the quarterly report, Ross. So it hasn't hit a three-figure sum yet. I think we can live with the amount of complaints we're getting. Just make sure they're actioned as efficiently as possible. And if things can continue, I'm sure we'll turn a corner. And hopefully at the next meeting of this particular forum, things are looking a bit rosier than they are at present. And I thank you for your attendance through Zoom. Thank you for your inputs and wish you as well to stay safe over this particular period. Now that we're all in lockdown, or will be on Friday, you better make hay while the sun shines over the next 48 hours. Thank you. Stay safe.
Thank you, Tommy.
Thanks, all.
Yeah.
Thanks to the chair.